After 60, these 5 foods can help an enlarged prostate. And one matters more than most men realize. Your urologist has a prescription pad and maybe 15 minutes. And in those 15 minutes, he may tell you that your prostate is enlarged, that your bladder is not emptying the way it used to, that waking up at night 3, 4, even 5 times has become common for your age, and that if your symptoms get worse, there are medications and procedures that can help. But what often does not fit into those 15 minutes is this. Your prostate is not just a passive gland that decides to misbehave because you turn 60. It is living tissue, hormone-sensitive tissue, inflammation-sensitive tissue, blood flow-sensitive tissue, metabolically active tissue, and that means what reaches it through your bloodstream every single day. Your weight, your insulin levels, your inflammatory load, your diet quality, your sleep, your physical activity can influence how it behaves. Now let me be very clear from the start, because credibility matters. No food is a magic bullet for benign prostatic hyperplasia, or BPH, the medical term for an enlarged prostate. No grocery item replaces a proper diagnosis, and no YouTube video should persuade you to ignore blood in the urine, fever with urinary symptoms, severe lower abdominal pain, or the inability to urinate. Those require medical attention, not wishful thinking. The NIDK is very explicit about that. Source. But here's the part too many men never hear. Even though diet has not been proven to single-handedly cause or prevent BPH, major clinical and review literature does suggest that lifestyle changes, dietary pattern, body weight, physical activity, and certain food compounds can meaningfully influence urinary symptoms and the environment that drives prostate irritation and growth. In other words, food may not be the whole story, but it is absolutely part of the story. Source, source, source. And that matters, because by the time many men seek help, they are not just annoyed, they are exhausted, and they have quietly accepted a lower quality of life because nobody has shown them what is still modifiable. They are avoiding movies because they do not want to stand up twice. They are sleeping lightly because their body has trained them to expect another urgent trip down the hallway. They are losing confidence in social settings, and they have quietly accepted a lower quality of life because nobody has shown them what is still modifiable. Today, I want to change that. I am going to walk you through 5 evidence-informed dietary strategies that can support prostate health after 60, especially when the goal is fewer symptoms, less irritation, better bladder habits, and a more favorable internal environment for the prostate. Not hype, not miracle cures, not fantasy, just the smartest, most practical grocery store moves you can make. And before we get to number 1, I am going to tell you something that may surprise you. The most important food strategy is not the most exotic nut, the rarest berry, or the most expensive supplement. It is the one that changes the biological terrain your prostate has been living in for years. Let's begin. Number 5. Cooked tomatoes in olive oil. If there is one prostate-related food compound nearly every man has heard about, but very few men use correctly, it is lycopene. Lycopene is the red carotenoid pigment that gives tomatoes their color, and the prostate seems to accumulate lycopene in relatively high concentrations compared with many other tissues. That alone has made researchers interested in whether it plays a protective role in the aging prostate. Now here is where honesty matters more than hype. The evidence on lycopene is promising, but mixed. Observational data and mechanistic studies have been encouraging, and some small studies suggest it may slow aspects of prostate tissue change. But systematic review evidence has concluded that there is still not enough high-quality randomized trial data to definitively support or refute lycopene as a treatment for BPH. So if someone tells you tomatoes are a proven cure for an enlarged prostate, they are overstating the science. Source. That said, not a cure is not the same thing as not useful, because what happens to the prostate with aging is not just enlargement in a mechanical sense. It is also oxidative stress, low-grade inflammation, altered cell signaling, changes in local hormone metabolism, and often a broader metabolic pattern that includes increased abdominal fat, higher insulin, and vascular dysfunction. Lycopene matters because it appears to interact with several of those pathways at once. It is an antioxidant. It may influence inflammatory activity. It may affect how prostate cells respond to oxidative damage. And when you combine that with the broader benefits of a meal pattern built around vegetables and healthy fats, tomatoes become a very smart inclusion. But preparation makes a difference. Raw tomatoes are fine. Cooked tomatoes are better for lycopene bioavailability. And cooked tomatoes with olive oil are better still. because lycopene is fat-soluble. Heat helps release it. Fat helps absorb it. So instead of thinking in terms of a supplement, think in terms of a habit. A Mediterranean-style sauce over fish, white beans, or whole grains. A Mediterranean-style sauce over fish, white beans, or whole grains. Tomatoes, slowly cooked in extra virgin olive oil with garlic and onions. A Mediterranean-style sauce over fish, white beans, or whole grains. That is how you turn a promising nutrient into a repeatable weekly pattern. Here is also what makes this strategy better than the original internet version of the story. You are not depending on one isolated compound. You are getting a matrix of benefits. Tomatoes bring lycopene. Olive oil brings polyphenols and a healthier fat profile. If the meal includes legumes or vegetables, you lower inflammatory load and improve satiety. If it replaces processed fast food, you have already reduced one of the very forces that tends to worsen urinary and metabolic health over time. So yes, lycopene belongs on the list. But not because it is magic. It belongs on the list because cooked tomato dishes, done the right way, are one of the easiest, most sustainable prostate-friendly upgrades a man can make after 60. 3 to 5 times per week, and whenever possible, make it part of a meal built around olive oil, vegetables, beans, fish, or whole grains, rather than processed meats and refined starches. That is how food starts behaving like support instead of entertainment. Number 4. Pumpkin seeds. Small food, real human data. Now we move to something many men overlook because it seems too ordinary to matter. Pumpkin seeds. And unlike a lot of trendy prostate foods, pumpkin seed has something many internet claims do not have. Actual human trial data in men with urinary symptoms. One randomized placebo-controlled study in men with lower urinary tract symptoms, suggestive of BPH, found that pumpkin seed use over 12 months led to a clinically relevant reduction in symptom score compared with placebo, though the findings still need further confirmation. In a separate area of evidence, beta-sitosterol, one of the plant sterols found in foods including seeds, has shown improvement in urinary symptoms and flow measures in men with mild to moderate BPH, although it has not been shown to reduce prostate size. That distinction is important. Better urination does not always mean a smaller gland. Sometimes it means improved function and reduced irritation. Source. That matters more than most men realize, because what ruins quality of life is not an ultrasound report. It is the lived experience of symptoms. It is the weak stream, the hesitation, the stop-start urination, the feeling that the bladder is still partly full, the nighttime awakenings, the urgency that turns every errand into a bathroom map. Pumpkin seeds are interesting because they bring more than one possible mechanism to the table. They provide phytosterols. They provide minerals including magnesium and zinc. They provide healthy fats. They are not a miracle, but they are a compact, functional food that fits extremely well into a prostate-supportive pattern. And unlike medications, where men often worry about dizziness, sexual side effects, or blood pressure issues, pumpkin seeds are not introducing that kind of pharmacologic trade-off. That does not make them a replacement for proper care. It makes them a very reasonable first-line nutritional support or add-on. The biggest me-at, sprinkle them on oatmeal, mix them with seeds, or simply eat a small handful in the morning. The second mistake is expecting overnight. That is not how food works. Drugs often push one pathway. If you are looking for a simple sentence to remember, it is this. Pumpkin seeds are not dramatic, but they are one of the better evidence-backed foods for urinary symptom support. And for many men over 60, that makes them worth far more than their price. Number 3. Pomegranate. Promising, but use it honestly now, pomegranate. Uwizard Wally, the astrosource. So why keep it on the list? Because men do not live inside randomized anchor. It fits beautifully into an anti-inflammatory and in many men, replace. That is the lens I want you to use. Not miracle medicine, supportive biology. This is especially medicine. Now, if you use pomegranate, but do not turn a beneficial food into a sugar bomb. And do not granite, but do not turn a beneficial food into a sugar bomb by drinking oversized bottles every day. And do not treat it like a substitute for water, sleep, exercise, or professional care. A good PAC, a half cup of pomegranate and combined foods water. And so, yes, pomegranate deserves buzz, but not as an infomercial, as a smart supporting player in a broader prostate-friendly diet. Number 2. Nuts and minerals. H. Now we come to the category nuts. and the confu. Two of these, this one is the single most powerful prostate food on earth. That kind of language spreads fast. It is also usually misleading. Let's start with what is true. Nuts and seeds can absolutely belong in a poptic. But let Brazil nuts. Brazil nuts are famous for selenium, and rightly so. They are one of the most concentrated food sources of selenium on the planet. Selenium is important in antioxidant systems, and the prostate is a tissue where oxidative balance matters. But the leap from selenium matters to Brazil nuts are proven therapy for enlarged prostate is much bigger than many online scripts admit. Also, selenium has a selenium, so if you enjoy bioactive, measured use, not a free-for-all, one or two can be enough, depending on the source and size. They are a nutrient-dense accent food, not a the more the better prostate hack. Almonds and walnuts. These are excellent foods for the aging male body, not because they have some mystical direct line to the prostate, but because they improve the quality of the diet overall. They can help reduce reliance on refined snacks. They contribute healthy fats. They pair well with fruit and yogurt. They fit weight-conscious eating, and body weight, waist circumference, and metabolic health matter a great deal for urinary symptoms. Pumpkin seeds. We already covered them, but they belong here too, because now let me tell you what doesn't deserve hero status. Peanut butter as the #1 prostate food. That claim is not supported well enough to make it the center of an evidence-based BPH script. In fact, prospective cohort evidence on nut and peanut butter intake does not show clear protection against prostate cancer source. So where does that leave us? With a better, more mature conclusion, use nuts and seeds as par. A small handful of mixed nuts. A table-measured use of Brazil nuts, not excess. A shift adan, and a focus on whole foods that improve the terrain in which your prostate is operating. That is real, and real nutrition almost always sounds less dramatic than bad market. Number 1. The big. Now we arrive at number 1, and if you were expecting me to tell you that one nut, one berry, one powder, or one spread is the ultimate answer, I am going to disappoint you. Because the most powerful nutrition is the overall pattern that reduces the biological rate. The literature increasingly points in the same direction. Dietary patterns closer to the Mediterranean model, rich in vegetables, fruits, legumes, nuts, fish, olive oil, and less dominated by processed foods and saturated fat, are associated with more favorable outcomes in BPH risk and symptom burden. Review work also suggests that lifestyle change, exercise, protein quality, micronutrient sufficiency, and diet modification can favorably influence symptoms. Source. Why is this numb? Because the prostate does not exist in isolation. If you have gained vicemes, if your blood sugar is unstable, if your diet is dominated by processed food, excess calories, if you are sedentary, circulation is worse, insulin sensitivity is worse, sleep is often worse, and symptoms may feel worse. So the question is not just, the better question is, what dietary pattern changes the whole environment in which the prostate is trying to function? That is why number on here is what that plate looks like. Half the plate is from vegetables. A quarter from protein, be a quarte olive oil, is the primary added fat. Seeds and nuts in measured amounts. Tomato base. Regular use fruit replaces ultra-processed sweets more often than not. And just as important is what starts fading out. Highly processed snacks. Sugary drinks. Heavy evening eating. Too much caffeine. Too late in the day. Large flu. That last point matters because sometimes men hear diet and prostate and think only in terms of tissue growth. But symptom relief is also about bladder behavior. The NIDDK specifically advises practical measures such as drinking fewer liquids before bed, or BFOs, source is new. And this not when they add one magic food on top of a bad lifestyle, but when they stack small tomato-based meals, pumpkin seeds, B, more fiber, less late caffeine day, daily walking, some weight losses, and fewer processed foods feeding inflammation seed, and fewer processed foods feeding inflammation every day. That stack is powerful, from constant urgency to something manageable. From anxiety in public to enough confidence to sit through dinner, church, a road trip, or a grandchild's school event without scanning the exits. And that, my friend, is what real cart is. The Pa one well, you're older now, what do you expect? Age matters. Of course it does. But age is not the only input. Your prostate is listening. It listens to inflammation. It listens. It listens to insulin and metabolic health. It listens to body weight. It listens to the quality of the food you nourishing. So when symptoms worsen, do not think only in terms of bad luck or my body is falling apart. Ask better questions. Have I gained abdominal weight in the last 5 years? Am I overdoing caffeine? Am I sedentary? Am I waiting too long to urinate and training my bladder badly? Am I treating sleep deprivation? Am I waiting too long to urinate and training my bladder badly? Am I treating sleep deprivation as normal? Am I relying on one medication while ignoring the terrain that made the problem easier to grow in? Those are not blame questions. They are opportunity questions. Because anything modifiable is hopeful, and an enlarged prostate does not mean you are powerless. It means you need a smarter strategy. A simple daily prostate-friendly template after 60. Let me make this sev. If I were building a morning start with a breakfast that stabilizes blood sugar and does a full of cinnamon, walnuts, and a spoonful of seeds, or whole grain toast with avocado and a side of fruit, or whole grain toast with avocado and a side of fruit. If coffee worsens urgency, midday build lunch around self, a lentil soup with olive oil, a bean salad with chopped vegetables, fish with tomatoes, greens, chicken with quinoa, and a large side of vegetables, a Mediterranean bowl with cucumbers, tomatoes, olive oil, greens, and legumes. Afternoon. If you snack, snack with intention. A small handful of nuts, pumpkin seeds, fruit, plain yogurt, vegetables with hummus. Not because because every good snack is one less processed assault on your inflammatory load. Evening dinner should support sleep, not sabotage it. Less heavy dessert, and more meals your body recognizes as food instead of entertainment chemistry. Less salty processed restaurant food, less heavy dessert, and more meals your body recognizes as food instead of entertainment chemistry. A tomato-based bean stew, salmon with roasted vegetables, tofu or lentils with olive oil and greens, a vegetable-rich soup with a side salad and pumpkin seeds sprinkled on top. Then, if nighttime urination is a major issue, stop making your bladder work overtime with late evening liquids. That is not deprivation. That is strategy. Daily movement, and yes, this is a food video, but movement belongs here because diet and symptoms are intertwined. Moderate exercise shows up repeatedly in the literature as part of the lifestyle picture around BPH symptoms. You do not need elite training. You need consistency, a brisk walk after meals, light resistance work, mobility, less sitting, better circulation, better weight control, better insulin sensitivity, better sleep, better bladder confidence. Source. That is how a man, who should not just try foods and wait now. I want to protect you from a dangerous mist. If you have severe symptoms, food is support, not delay. Please do not sit on serious warning signs because you heard someone online talk about tomato sauce. Seek medical care promptly. If you cannot urinate, have fever and chills with urinary pain or urgency, see blood in the urine, or have significant DDK, and it matters. Source. Also remember, not every urinary symptom in an older man is just BPH. It could be infection, medication effect, bladder dysfunction, neurologic disease, or, in some cases, something more serious. So be proactive, not paranoid. Get evaluated. Know what you are, then use diet and lifestyle intelligently, as that is how adults do. What I would personally prioritize first. If a man came to me and said, "Don't give me 10 complicated rules. Just tell me where to start this week," I would give him this short list. Add pumpkin seeds daily. Eat cooked tomato meals 3 to 5 times a week with olive oil. Shift the entire diet closer to Mediterranean. Reduce late evening fluids, alcohol, and unnecessary caffeine. Walk every day and work on the waistline if abdominal weight is up. That is it. Because complicated plans often fail not from lack of intelligence, but from lack of a simple plan done consistently beats a perfect plan done for 4 days. Closing the queue. Let me leave you with this. The nightly bathroom trips, the weak stream, the urgency, the hesitation, the irritation, these are easy for other people to dismiss because they are not dramatic from the outside. But if you live with them, you know the truth. They wear down your confidence. They fragment your sleep. They steer. They make travel harder. They make public events feel risky. They make aging feel smaller than it has to feel. And yet this is exactly where men too often become passive. They wait. They mensy. They joke about it. They tell themselves all men their age go through this. and they settle for a life they do not actually have to settle. Here is the better mindset. Use procedures if you need them, but do not neglect the daily biological signals you control. Get evaluated. Use medication if you need it. Use procedures if you need them. But do not neglect the daily biological signals you control. Your it is receiving thousands of gest. It is receiving thousands of gest. Change those messages, and sometimes you change the experience of living in your body. Not say, not magically, but meaningfully. That is the word I want you to read. If you start eating more intelligently, if you support your bladder instead of provoking it, if you reduce the inflammatory burden your body is carrying, if you stop chasing miracle foods and start building a real pattern, you may not become 25 again, but you may sleep better. You may urinate with less frustration. You may feel more confident leaving the house. You may discover that what you assumed was just aging was actually partly neglect and partly biology waiting for better instructions. That is good news, because better instructions can begin today. So if I had to summarize this, after 60, the goal is not to find one magical food for the prostate. It is to build a way of eating and living that gives the prostate fewer reasons to stay irritated, inflamed, and symptomatic. And that is a goal worth pursuing. If this video helped you see, until then, take care of yourself, and take care of the signals your body has been sending you, because your quality